Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens. Join me, Dr. Tarryn, and health expert Emma as we explore delicate subjects related to the women's health space. We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin.
How's it,
To my monk.
I miss you too. I'm still trying to settle back in after such an amazing time back home, and I'll see if I still keep my South African accent, which came back in full force after some of my time back.
Yeah. Sending you big hugs from Cape Town. We miss you already.
Miss you guys so much.
How did you sleep last night?
I've been sleeping very badly since I've come back to France. Like, honestly, last night I think I woke up 4 or 5 times during the night. Anyways, I'm very excited to speak about the topic of sleep. And it's such an important topic, right? Because first we spend like half our lives sleeping, and sleep impacts so much of our life. It impacts so much of our cognitive functioning, hormones, all of this stuff. I've had sleep issues for years. In fact, actually, I spent Halloween 2 years ago in a sleep clinic, which was quite an experience. And what I find is when I listen to these different podcasts, or I listen to read stuff about sleep, I end up being more freaked out. Like, I remember I was having the worst sleep of my life at one stage, and my dad was like, I'm reading this book about sleep, and did you know you're probably going to have a shorter life if you don't sleep well? I'm like, that's all the stuff that's just not helpful to someone who's not sleeping. So I really hope that in this episode, we're not going to scare people. We're just going to be able to provide the right resources, understand why we sleep, how much do we need to sleep, who struggles to sleep, why. So we dive into that, but also some really helpful tips as to what you can hopefully do for your sleep if you are struggling. So I'm very excited to dig into this very important topic, but please don't freak me out further.
Yeah. Well, on that note, there's actually a term for what you experienced. It's called orthosomnia. So the fear of not getting enough sleep, and then that in turn perpetuating the vicious lack of sleep cycle. So yeah, definitely counterproductive. We'll tackle it all in this episode, of course. But before we do, just a quick disclaimer from my side. Although I am a qualified medical doctor, this podcast does not serve to offer any professional or personal medical advice. So always seek the advice of a healthcare professional with regard to any condition or treatment you may be seeking.
Thanks, Tara. So let's dig in. Let's start off with the absolute fundamentals. Why do we sleep? From an evolutionary standpoint, it makes absolutely no sense. I mean, we're super vulnerable when we sleep. We're going to be attacked by wild animals or whatever when we're staying and chilling in our caves. So from an evolutionary standpoint, it doesn't make any sense. Why do we sleep? And why is it so important?
So clearly sleep is so important that it has evolved with us. So just to highlight that, it is critical to our survival because it serves so many fundamental purposes. I mean, the list is very long. I'll try summarize it, all the benefits that there is to sleep. So firstly, immunity. If you sleep, it boosts all your immune cells. Generally, people have stronger immune systems. They're more resistant to getting infections. They're more resilient. So there is immunity. It boosts growth hormone. It also has a role to play when it comes to metabolism and weight control. This is a very big one. People who have impaired sleep, they find that there is an upregulation of ghrelin, the hunger hormone, and a downregulation of leptin, the satiety hormone, and they're actually more prone to wanting to pick out and eat. And I know, speaking from firsthand experience when I was working my night shifts, the first thing I'd want to do after a shift is go and grab a high calorie, sugary meal just to feed those impaired hormones that was just flowing in my body. So yes, there's that. There's the emotional component to sleep, which is so underlooked. So I love the way Matt Walker, he describes it. I listen to him a lot. He's amazing, like a sleep scientist. So he speaks to the fact that sleep serves as emotional first aid for the body. Basically free therapy overnight. So when you go to sleep and you dip into your deep REM stage of sleep, this is when all the emotional regulation and memory processing happens in the body. And it really has fantastic emotional, psychological benefits to play because it regulates your emotional system through the amygdala, the hippocampus, deep centers in the brain, and basically stimulates well-being essentially. So, I mean, I'm sure you could relate. After a poor night's sleep, you're more groggy, you're irritable. That all has a role to play in that cascade. And then, of course, cognition, memory. Sleep serves a role in consolidating new information and in fixating them into the neural architecture of our brain through memory processing. So unpacking all the memories of the day and consolidating it essentially into our brains.
So there's a lot to unpack there. And I do have like a lot of kind of a million questions that you've triggered as a result. I think let's go back to what you were saying about Matt Walker and what he was saying about the REM cycles and everything like that. I have a lot of questions to ask because it's like a therapy session, but I can tell you from having a lot of like nightmares and night terrors and being one of those sleepers that it definitely does not feel like therapy during my sleep. But let's talk a little bit more about the different cycles of sleep. REM cycle you mentioned. What else? Yeah. Just take me through that very, very, very quickly, just to cover off some of the basics.
Sure. So you've got REM, rapid eye movement, and non-rapid eye movement, very original terminology. So the non-REM is further subdivided into 3 or 4 stages, depending on which classification you're looking at. So stages 1, 2, 3, 4. And then it dips into REM. So when you're in your REM cycle, which is typically 90 minutes into your sleep, basically this is the stage where your eyes flutter. They flicker very, very fast and your body's paralyzed and you're in a very deep hallucinogenic state. And you're very deep in your dreams. And this is when all the good work is happening, all the benefits that I spoke to. It's all in your REM. It's like the most beautiful stage of sleep to find yourself in. And then you back into the cycle of non-REM. So in non-REM, it's your light sleep. You're kind of falling asleep, but you're in a very light mode. Then you go into the second stage, which is slightly deeper. This is when your body temperature drops, heart rate slows down. You're not quite deep yet, but you're going there. And then in the third stage of the non-REM, this is when you're in a relatively deep form of sleep, but you're not quite in REM yet, so your eyes aren't flickering. When you go into REM, interestingly enough, it's also known as paradoxical awake sleep, because this is the stage of sleep where if you look at the activity in your brain, it's fluttering at a very low amplitude, high frequency, which is much like one observes when they're awake, interestingly enough. So it's actually quite paradoxical in nature.
So you go into like 5 REM cycles.
Pretty much.
Okay.
Yeah, 5 to 6.
And then, so REM is when you're having these dreams, and that's also when that cognitive rehabilitation, so to speak, is happening, right? So REM is the very important one for the cognitive functioning, if that's what I'm understanding correctly. But it's also the time that you're dreaming and you're processing everything probably from the day. Is that correct?
Yeah. Correct. And I would also say the third stage of non-REM, you also have some deeper cognitive processing happening there, but more so on a deeper level in your REM. And a lot of the emotional processing is happening in the REM.
So a bit of like a curveball kind of question, but like some people, first of all, don't remember their dreams. So they say, oh, I don't dream, but everyone dreams, right? If they go into a REM cycle, they just don't remember because they then come into that non-REM cycle. Is that it? Or does it matter when you're waking up in the middle of the night as to whether you remember your dreams or not?
Correct. So people generally tend to remember their dreams when they wake up in REM. And then that's when your dreams are most vivid.
Yeah. And is that also when you feel maybe more tired if you wake up during REM because you're in that deeper sleep, or doesn't really matter?
Not necessarily. If you wake up naturally with the natural light, you wake up before your alarm, even if you're in REM and you're waking up naturally, yes, sure, you might feel a little bit groggy initially, but not so much. But if you're waking up, you've abruptly woken up with an alarm and you're in the deep REM, then yes, you would be groggy. I would say definitely the non-REM, the third stage, quite deeper sleep, people tend to be very groggy when waking up then. Perhaps even more so than REM.
Just one other question on the kind of having the REM cycle element in your dreaming and stuff like that. What happens then if you're having nightmares during the REM cycle? Would that also then have that restorative effects, or it's one and of the same?
Probably one and of the same. What's more important is that you're actually going into the REM and you're having good quality sleep. So even if you're having nightmares, so long as you're dipping into REM and the quality of your sleep is not impaired, you should feel well rested, regardless or irrespective of whether you've had a night terror or not. But generally, night terrors can awake you from your sleep. And if that's the case, well, then your sleep is impaired. So the quality is questionable.
And we're definitely going to get into that because I would like to talk about who struggles with sleep and why. But before we do, just to kind of recap, sleep is hugely important. So important that from an evolutionary standpoint, we still sleep, even if it's like a risk for our survival to sleep, for the cognitive, emotional, everything, hormonal standpoint.
Yeah.
And we have about 5 cycles of sleep per night in an average sleep cycle. How much do we need to sleep? So in average, like how much do we need to sleep? Does that also differ if you're a man or woman or of a certain age? I know teenagers need to kind of sleep more than adults. In general, how much do we need to sleep overall?
Yeah. So as you actually correctly pointed out, it is age specific as well. So younger neonates, babies sleep for very long because it's so imperative to their functioning, their brain processing, the development. The babies sleep for long. If you are a teenager, you also sleep for quite long because you're going through puberty and all these hormonal challenges on the brain. And me as a teenager, I would actually sleep in, which I can't even imagine doing now because I'm such a morning person. But yes, if you are above 18, 7 to 9 hours of sleep is the global recommendation.
7 to 9 hours on average, whether you're a man or a woman, that's how much you should sleep. Or does it differ that women need to sleep more too?
No, so 7 to 9 hours is the global recommendation, whether you are a man or a woman. The question of whether women would benefit from more sleep is true. Women do on average need a little bit more sleep than men, but that doesn't mean that they must exceed 9 hours. So on average, women should get maybe 20 minutes more of sleep than men. And this is because women, especially women that are assuming caregiving roles, they really need that downtime to promote their cognitive reserve because they're just being so depleted in all other areas. So there's that. Then there is also the fact that there is the impact of hormones on their brain, which can sometimes disrupt sleep. So for example, in perimenopause, when there are all these fluctuations and one's encountering all these sleep disturbances, they are sleeping less. So hence they need like that extra 20 minutes to recover, to almost match that of a man. So yes, on average, women do need to sleep a little bit more than men.
And then you mentioned, okay, you need to sleep a little bit more. Can you actually catch up with sleep? Like sleep debt, for example. So say during the week you sleep, 5 hours because you were, having a lot of dinners, having to get up for work. But then on the weekend, you're like, I need to catch up with sleep. So I'm going to have, sleep in until 11 or whatever it may be. It's a Sunday. I need to sleep in because I need to catch up with sleep. Is that actually a thing? Is it possible to catch up with sleep? Is sleep debt real?
Well, firstly, what is sleep debt? So sleep debt is the difference in the amount of sleep that you get versus what you actually need. So for example, if you need to sleep 8 hours, but you're sleeping 6 hours, you are then 2 hours into sleep debt. And in answer to your question, Em, it's not so much a problem if it's in the acute setting. So 2 hours here, 2 hours there, sure, you can catch that up. If it is, however, chronic sleep debt, so over months, over years, lack of sleep is a type 2 carcinogen. So basically, it actually predisposes people to cancers. It reduces their lifespan by, I don't even know how many years, I think like 5 to 10 years, but it's a crazy amount. Anyways, so chronic sleep debt, this is very difficult to catch up on and very concerning. Not to freak all the healthcare workers out there, but it is a huge problem and something that I grew increasingly cognizant of and worried about because I want to live longer. And yeah, anyways, so chronic sleep debt is difficult to catch up.
You can't. You just have to get your sleep back into a regular pattern again.
Yeah,
if you can.
Exactly. If you can. So what you would do is try basically follow the natural rhythms of the light, like work with the light. So in other words, go to bed in the dark, wake up with natural light, try go to bed a few minutes earlier every night, but try stick to a same routine as well. Stick to like a regular schedule, but very impractical when you're working erratic work hours. I completely acknowledge that. I completely acknowledge that. But
and for
yes,
parents too, right? Because I think, and that's what I wanted to get into, like, who struggles with sleep and why do people struggle with sleep? You know, there's parents, there's healthcare workers, people who do night shifts, all of these kind of people that are going through this, they can't sleep. Who else struggles with sleep? Why do some people struggle with sleep and others don't?
Yeah.
And what sleep disorders are there that people need to be aware of? Things like sleep apnea, or why are some people having night terrors, sleep paralysis, all of those kind of issues?
Very good questions you're asking me. Okay, so sleep disorders can be divided up into a few categories. So you've got let's say your primary sleep disorders that you've mentioned. So correctly identified sleep apnea is a massive one, which women are susceptible to in menopause because of the dropping estrogen and progesterone levels, which were before protective of their airways. You then lose that, and a lot of women then develop apnea at a later stage in life. Otherwise, men have it more than women until perimenopause, menopause. That's when it actually equalizes. So that's the one sleep disorder. Then you've got insomnia. I think women have it twice as more as men. So, and this can be due to underlying anxieties, which can further precipitate it. So you've also got the mental health component there. Then you've got parasomnia, so night terrors, sleepwalking, circadian rhythm disorders. So those night shift workers that just can't regulate. Also like pilots, I'd imagine, would succumb to that, and flight attendants. And then lastly in that category, you've got narcolepsy, which is another big one, where your sleep quality is severely impaired and you're waking up feeling groggy, and then hence as a consequence falling asleep randomly throughout the day. So that's the sleep category. Then you've got the medical category. So patients might have chronic pain, fibromyalgia. They might have restless leg syndrome, and that's keeping them up all night. They might have autoimmune illnesses, impaired hormonal function. So hypothyroidism, for example, that's a big one, because if your thyroid hormone is upregulated, you constantly feeling a little bit anxious, palpitations, and that can affect your sleep. So that's a huge one as well. And of course, asthma, COPD, snoring or sinusitis, not getting the air into your lungs due to obstructions in the nose or in the lungs. And then, of course, there's the hormones in and of itself. So perimenopause. I mean, we've spoken to this ad nauseum. I'd actually like to tackle sleep pertaining to women's health in a separate episode entirely, because there's just so much to talk about there. But yes, the impacts of hormones on sleep is huge.
So if you are struggling with sleep and you're having all of these different things, it sounds like there could be an underlying issue that you should address with your healthcare professional, and understand that just chronic, like not sleeping and chronic bad sleep could be either stress related or anxiety related, but it could also relate to maybe or pertain to something that could have other reasons that might be disrupting your sleep, that you should be investigating with a healthcare professional.
Yes, thank you for clarifying. Absolutely. If you are concerned about your sleep or lack thereof, absolutely consult a healthcare professional who can make an accurate assessment and take it from there.
And I guess the way to test that and to investigate that is probably that they would run a series of tests on you, or...
Yeah, well, depending on what you're searching for. So if you're wanting to work a patient up for sleep apnea, you can send them to a special sleep apnea clinic where they tie you up to machines and do all these specialized testing. There's also sleep clinics designed to look at how patients sleeping and the quality of their sleep, and REM and non-REM, to work them up for various sleep disorders. So there's that. And of course, the medical side, a doctor, a primary care physician can easily tackle just through taking a comprehensive history and examination and certain investigations at their disposal.
Yeah, just look, I'm speaking from full experience where I have a lot of very active nights where I'm, I don't know, apparently running and terrifying my husband half to death, like screaming in the middle of the night, and apparently running into doors and everything like that, and quite active nights. I can say it really takes it out of you. And like even now, like I haven't slept properly maybe in 2-3 nights, and honestly just trying to focus and just trying to keep a conversation or a train of thought. If you've got a disorder, if you're not sleeping for certain reasons, what can you do and what shouldn't you do? Like, I know, for example, blue light is a big thing, like not being on your phone before bed, switching off your phone for 1 hour before bed. But what other stuff? Things like, should you be sticking to the same bedtime every single day, or weekends? Should you be waking up even at like 7 o'clock because you do that during the week? What are some of the things that you should be looking at in terms of sleep hygiene and helpers?
Okay. So regularity, very important. So sticking to a consistent sleep routine is essential. And yes, if that means waking up at a similar time on the weekend, ideal. I mean, maybe you could push it by an extra hour, but definitely not sleeping in too late. Okay. Let's just talk about the do nots and then we can talk about the do's. So the do nots, caffeine. Caffeine is a potent stimulant and it works by blocking adenosine receptors in the brain. And what this does is, adenosine is a very important molecule that builds up throughout the day, and it basically promotes nighttime sleepiness. And in drinking caffeine and blocking those receptors, you almost lose that ability to feel sleepy. So because caffeine has quite a long half-life, like 6 hours on average, of course, it's metabolized differently by different people, but the recommendation is actually to stick to it in the morning, not have a coffee later than 12. Some people even say 10 a.m. I think that's a bit of an exaggeration, but yeah, 12 o'clock is fine. And if you really feel like you need that extra boost in the afternoon, which I most certainly always feel like I need, there are other ways to mitigate that afternoon crash. So for example, you could go for a run. You could even have decaf coffee and trick your body into thinking that you're having caffeine. Placebo effect. It's a thing. So there's that. There's going for a run or just exposure to bright lights, kind of like regulating that way. That's really, really important. So even a glass of hot water, by the way, can also just like wake you up. So limiting caffeine is a big one. Alcohol. Perhaps the most misunderstood sleeping aid that there is, because it is a very strong sedative. So yes, you can fall asleep easily, but will you have good quality sleep? Will it impact you dipping into the beautiful REM that we want to accomplish? Absolutely. And it will impede your sleep. And I'm sure I know speaking from personal experience, after a bender out, I've had a few drinks, crashed on the bed, my proudest moments in my 20s. But yeah, when I would do that, I would wake up feeling terrible. Yes, because I drank, sure, but also because I didn't sleep well. So alcohol definitely impairs your sleep quality and it's not good.
Even one glass of wine or one little whiskey or little, because it's funny, right? We used to call it a nightcap, and you'd have, and yeah.
Yeah. I mean, obviously, the more, the worse. Everything in moderation, the global rule. If you are going to have a glass of wine, just do it earlier, long before you're going to go to sleep. So I wouldn't swig down a glass of wine and go to bed, but do it maybe as an aperitivo, in the late afternoon, early evening. It should be okay. I mean, it's not a recommendation in general. WHO says no alcohol is good for you. So I'm certainly not going to go on this podcast and say, yeah, guys, you can drink alcohol. I have to be realistic here. Alcohol is not good for you and it's not good for your sleep. But yes, we also are human and everything
just
in moderation.
Just good for your soul.
Yeah.
Glass of wine. No.
Oh, perché no? Okay, then we've got smoking. Smoking has very, very potent effects on your sleep, and this works through the nicotine receptors, which basically has direct impacts on the nervous system. So it puts you into sympathetic drive, and this can in turn affect the natural body's circadian rhythms. So it does interfere with your sleep quality. Then we've got stress. So it's kind of obvious, but it's nice when you actually think of the science. I find it really interesting. So stress, the way it impacts sleep, or one of the big ways that it impacts sleep, is through progesterone, because cortisol and progesterone actually share the same precursor. So what happens is when cortisol is upregulated through stress, it actually downregulates the production of progesterone, which is needed for sleep. In fact, women in menopause often love taking progesterone, because yes, they need it to counteract the estrogen if they're taking hormone replacement therapy in the form of estrogen, if they have a uterus. But a lot of them take progesterone, and it's like an off-label drug for sleep. So it's known to have calming effects and what have you. So progesterone is very important for sleep, and cortisol affects that.
Which explains to an extent, and I know we're going to cover this in a separate episode, but it does to an extent explain why women's health issues, progesterone, all of that kind of
Yeah.
stuff can really send you off kilter, right?
Yes,
That's
absolutely.
really interesting.
Absolutely. So just to summarize, we've spoken about the many don'ts. Just to add one more don't is having a late meal at night. Not a recommendation. It also depends on the quality of your meal. So if it's like a high carb meal, it might impact your sleep. But having said that, everybody's different. Everybody metabolizes food differently. I lived in Italy for a year, and people would have also like a espresso and like a bite to eat late before bed. And I mean, I don't know, they seem to sleep fine, but it just depends on where you are in the world and what you're used to. But certainly in South Africa, stick to hospital eating times, like at least 3 hours before sleeping would be advisable.
And what about blue light?
Okay. So yes. So another thing to avoid is blue light. And what is blue light? Blue light is a short wavelength, high frequency visible light. And yes, it's emitted from the sun, but you can also access blue light through LEDs, phones, tablets, television, computer screens. And basically it tricks the body into believing that it's still daytime. And then this in turn inhibits melatonin. Now, melatonin is naturally produced in the brain, in the pineal gland. And it's produced at night to stimulate sleepiness and induce you into a sleep state, put you to sleep. Blue light blocks the action of melatonin, so it might be more difficult to fall asleep. So the recommendation is to keep TVs and phones out of the bedroom. Not practical advice because I myself do not stick to this. I wish I took my own advice. So yeah, so those are the big do nots. Then when it comes to the do's, temperature. So cooling your body, even just by 1 degree, is ideal. So practically speaking, 18 degrees Celsius is the ideal temperature for sleep state, or for falling asleep and inducing sleep. So you'd want to do that. So don't sleep with too many layers, essentially, is the important takeaway. And then just keeping the room dark, or not, being in a bright room at least 1 hour before sleep. Meditation is definitely a beautiful way to just calm you down and like put you into that Zen state to optimize you for sleep. I love reading a book before bed, and I have been asked this question, whether the light of a Kindle is detrimental to inducing sleep. And it's not ideal. It's definitely reading a hard copy novel is better because of that lack of light exposure, but it's not as bad as like staring at a screen or watching a TV. And also the act of reading also just puts you into a very calm state. So for me, it works.
It does for me too. Like I love reading before bed, and I do read on my Kindle, which is not, I think, ideal.
Yeah. And then what about like mouth taping? So this is a trend that I've seen on my TikTok. But yes, mouth taping is something that's crossed my radar. So basically it's gaining
the daily shed, right? Like, I mean, that's a topic of itself, but the daily shed, you've seen that?
No.
Okay, well, they basically like shedding like all this stuff, and mouth taping is one of these.
Yeah, mouth taping, it's gaining popularity as a simple technique to promote nasal breathing, which we know is super, super important, not just for sleep quality, but for overall health and also for airway function. And in patients with very mild sleep apnea, it is a nice adjunct to use as a way to prevent snoring or reduce snoring and airway collapse. But I must just reiterate here, that's not routinely recommended for all patients with sleep apnea. So definitely go and get it evaluated, because there are superior methods for the treatment of sleep apnea. But yeah, I mean, if you don't have sleep apnea and you just want to try, promote nasal breathing, and you think that that's going to possibly improve your sleep, there's no harm in mouth taping, provided you don't have any contraindications. So for example, the untreated sleep apneas that I mentioned, nasal congestion. So if you're a little bit sick or a little bit blocked, probably not recommended that you also obstruct by the mouth. And then it shouldn't be done in children without supervision. And if you're like known with severe anxiety and claustrophobia, probably not the method for you either.
That's so interesting, because I have mild sleep apnea, which I figured out through the sleep clinic. And I am more of a mouth breather, and the mild sleep apnea, what they said is that creates hyperfragmented sleep because you're not breathing properly. It sends your body into flight or fight response mode. And the mouth breathing also impacts that further. But when I was looking into mouth taping, there were so many people like, there's no science to back it up. It's just a TikTok fad. It's like, there's nothing to it. but people do swear by it. And maybe it's just that there's not enough science out there at the moment to validate it, right? There hasn't been research into. So I'm definitely going to give that a try.
Yes.
What about magnesium?
So magnesium is actually a very interesting area that's being explored because there's different types of magnesium. So magnesium for the body just has so many different functions. But the two magnesiums which are being actively researched is magnesium glycinate, which is very good for reducing anxiety and, yes, indirectly improving sleep. And then there is also magnesium threonate, which is fascinating because it crosses the blood-brain barrier and it's actually can act deep in the brain. So this is a magnesium supplement that's being heavily researched at the moment for improving brain health and cognition and also maybe indirectly sleep. But on the whole, magnesium, the evidence is actually quite uncompelling to date. So it's not as superior to other sleep aids. What are your thoughts on it? Does it work for you?
Well, the interesting thing is that I think a lot of people don't realize that there are different types of magnesium.
Yeah.
So I know for myself, I was taking magnesium and it did help with like muscle aches and stuff like that. Honestly, it helped with like indigestion issues, but I didn't find that it was really helping me with my sleep. I wasn't feeling better rested. But I think it was also that I was taking the wrong magnesium. So I was taking like a magnesium citrate, and that was just not really helping me at all. But yeah, I'm curious about it. I wonder if it's just that there's not enough evidence or science also looking into it because they haven't done enough clinical trials to really validate it. But a lot of people swear by it. So I don't know if that's, again, placebo but a lot of people say that it really hugely helps them with their sleep.
So it most definitely helps people who are deficient in magnesium. And specifically, this is the elderly, because the elderly have absorption issues or perhaps decreased intake. So the elderly are predisposed to magnesium deficiencies. And so for them, consuming magnesium is very, very beneficial because it just restores the natural levels. But there's so many other sleep aids. The chamomile tea, for example, this is another one because it actually works on receptors in the brain similar to where the benzoreceptors act, benzodiazepines, which is calming and it's used in the treatment of anxiety. So perhaps chamomile tea doesn't induce such potent effects, but definitely been shown to be quite beneficial for those who like the taste of it. I personally don't. And then all the other supplements that I've researched.
Melatonin?
So melatonin is good for inducing sleep, but not making you stay asleep. So
okay, that's definitely been my experience with it.
Yeah. So it's good at, it basically acts on the pineal gland, and it's very good for people with disturbed sleep due to, erratic work hours, night shifts. So it's very good to kind of trick the body into saying, okay, it's nighttime, go to bed now. But it's not a fantastic sleep aid in the long term because it's not going to make you stay asleep for long. So yeah.
And what about lavender and all of these kind of things, essential oils, all of that? Is that something to kind of look into?
So I would say anything that encourages a nice nighttime routine is beautiful in and of itself and just promotes well-being, gentleness, and reduces anxiety. So from that perspective, if you're known to suffer from anxiety and you're just kind of wanting to down-regulate a little bit, sure, those are great aids. Are they superior to all the other aids that we mentioned before? No. And perhaps a topic that we have grossly overlooked in today's conversation is the importance of psychology and psychotherapy. Cognitive behavior therapy is very beneficial at helping people with sleep problems, and it's not discussed enough. It's superior to sleeping pills and all these little sleep aids that we've mentioned. So cognitive behavior therapy is definitely something that one should look into if they're suffering from insomnia or sleep disorders in the absence of medical causes.
Yeah, and hypnotherapy, I imagine, to an extent too, right?
Yeah, there's cognitive behavior therapy, and then there's also another one called acceptance and commitment therapy, which is similar to cognitive behavior therapy, but it's slightly different. But basically, I'm not an expert in therapies, but the psychological impact when it comes to sleep should not be overlooked.
And lastly, snoozing. How bad is snoozing? So if you press to snooze on your alarm a million times, and this is an argument I have all the time, I'm a serial snoozer. I have 15 alarms on, and it's really bad, right? It's better to just get up and get going?
Well, if you are struggling to wake up when the alarm goes off, you're not getting enough sleep. So that's a sign to your body that you didn't sleep enough, or perhaps you're waking up in a very deep sleep. But you should feel well rested when you wake up in the morning. And if you're continually snoozing, I would say, yes, that is a bad thing, because it's signaling to your body that you didn't get enough sleep.
Well, I saw this really funny meme that was like, I'm not a morning bird. I'm not a night owl. I'm a permanently exhausted pigeon. And that like really resonated with me. And I think we've covered already so much about, why sleep is so important and why do we sleep? How much should you sleep? Like 7 to 9 hours. What can you do to better aid your sleep? What shouldn't you be doing? Put that phone away before bed. Go into a dark room. Is there supplements that can help? Melatonin. So we've covered so much today. And I think there's definitely almost another 1 or 2 episodes on, as you mentioned, women's health, the impact of hormones on sleep linked to, menopause, PCOS, all of that kind of stuff. And I would still like to cover off whether or not I can actually become a morning person, because I don't fully believe it, but I really want to believe it. Thank you so much for such a wonderful discussion today.
Yeah, no, it was so great chatting about sleep. And I really hope I take my own advice because, as I said, I'm not the best sleeper, although I am a morning person. So I'm definitely keen to share some of my tips with you with our next episode. And yeah, thank you all for tuning in. Be sure to follow us at The Ovarian Club on Instagram. And we're also available on all streaming platforms, Spotify, Apple, YouTube. You can also feel free to email us at theovarianclub@gmail.com. Wishing you all a beautiful day ahead and a great night's sleep if you're about to go to sleep, or if you haven't fallen asleep already listening to this podcast. No offense taken. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. See you soon, follicle friends.